If you take a look at patients that were fully vaccinated and ended up getting breakthrough COVID and getting hospitalized, 44% of that group were immunocompromised. So this was a greater culmination of taking a look at the lab values and what the science was telling us, along with what was happening with real-world evidence. They were able to surmise that these patients should receive a third dose.
Welcome to 20-Minute Health Talk. I'm your host, Rob Hoyle, and today our special guest is Dr. Onisis Stefas. He's the Chief Pharmacy Officer at Northwell Health, and the FDA just gave amended emergency use for a third dose, a booster. We've been hearing about this, but now it's here. Tell us who is going to be eligible for this third booster shot.
Great. Thank you very much, Rob, and thanks for having me here today. So it's very interesting. When I think about the third dose for the immunocompromised patients, I really don't think about it personally as a booster. There's a multitude of different reasons why the immunocompromised patient, may require a third dose. First and foremost, when you look at immunocompromised patients, there are patients that have a weakened immune system. So with that, in the event that they do get COVID, they're going to have poorer outcomes than a healthier patient. In addition, if you're immunocompromised, you may not be able to mount an adequate immune response to the vaccine itself. So people that are immunocompromised tend not to have as good as coverage of the vaccine as opposed to a healthier person as well. So those are the two main reasons why I think that the FDA and the CDC focused on this specific population.
Most people are calling this a booster shot, but it's really just a third shot.
Yeah, that's correct. I mean, I would consider it a third dose, and I would even consider it being almost like a 3-dose regimen for immunocompromised patients. When I think about boosters, I think about people that got a full immunologic response to the vaccine and therefore need another one over time because that immunity may be decreasing over time. In the instance of the immunocompromised, they're going to get the 2-dose regimen and then another or a third dose 28 days after that. So I would consider that as part of their course of therapy. And because they're immunocompromised, they're requiring that third dose. So they really need that third dose to kind of reinforce that and give them as much protection as possible against the coronavirus. Because once again, these immunocompromised patients, in the event they do get COVID, tend to have poorer outcomes than healthier patients. So giving them that third dose really gives them some better protection than the first 2 doses. But, just because they're getting a third dose doesn't mean that they have better coverage than a healthier patient. Most of the studies are saying that they still don't have full coverage as a healthy person would with 2 doses. So once again, it's important that they maintain those precautions like the masks and the social distancing and really try to associate themselves with other vaccinated people just to reduce the chance of getting COVID.
Right. So the third shot then would be a great boost, not a booster, but a great boost for people's confidence and everything else. But when can immunocompromised people get that third dose?
So they can get that today. The emergency use authorization was amended. There's clear definitions in terms of who could be receiving this. So today you can get your third dose if you qualify at any place that currently has vaccines. Because the other thing to keep in mind is that third dose is identical to the first 2 doses that you received. So anywhere that has vaccinations should be able to provide you that third dose if you meet the criteria of that population.
Yeah, and I think that's something that a lot of people maybe don't understand, that when they got their first dose, it was the same as the second dose. It wasn't, shot A and then you got shot B that makes a combination. They're the same thing. It just boosts the immunity.
Yes, absolutely. So it's the same dose for all 3 shots that you receive from each of the different particular manufacturers. And once again, it's just introducing that foreign body back into your body a few times to reinforce the antibodies and the way your body needs to fight it in the event that they get the coronavirus into the system.
What do you do? Do you talk to your doctor, or is it somebody who maybe got the vaccine early on that's more eligible for it now?
So there are a couple of different patient populations that fit within this immunocompromised definition. So first and foremost, it's cancer patients. So patients that have cancer, particularly ones that are actively on chemotherapy agents, those are prime people that should be receiving it. The second group is patients that received an organ transplant. Because when you receive an organ, then you get medications that are immunosuppressive, so you don't reject that organ that you just received. So they're also a good candidate in order to receive the third shot. The third would be patients living with HIV, particularly advanced HIV. And then the fourth category is patients that are on like high-dose corticosteroids or immunosuppressive agents, which may not be able to fight off the virus as well. Those patients are like autoimmune patients. So like maybe they have rheumatoid arthritis or Crohn's and they're on high doses of biologics and other things that, inhibit the patient's immune system. If you take a look at patients that were fully vaccinated and ended up getting breakthrough COVID and getting hospitalized, 44% of that group were immunocompromised. So this was a great culmination of taking a look at the lab values and what the science was telling us, along with what was happening with real-world evidence, where it was from that information, they were able to surmise that these patients should receive a third dose.
As Northwell's chief pharmacy officer, what was your reaction when you heard a couple of days ago that the FDA amended the emergency use for that third shot?
So I was really happy to hear that, right? Because once again, this is a great culmination of looking at in vitro studies, all the studies that the manufacturers are doing, and then couple that with real world evidence of vaccine failure that's occurring today. Because once again, if you take a look at the patients that have that breakthrough COVID, which is people that are fully vaccinated and then get COVID and then were hospitalized, 44% of that population was immunocompromised, where only 2.7% of the population in general is immunocompromised. So once again, small population driving a large percentage of breakthrough COVID hospitalization. So between that real world evidence plus all of the antibody testing and everything else that supported it, I was glad to see that they took all that information and then they amended the EUA to give that population additional coverage and support. They approached it in a very meaningful manner. And then once again, they're also going to continue to take a look at antibody testing and everything else throughout. So, as we take a look, the coronavirus is still fairly new, as amazing as that sounds. But we're actively looking at the science. We're actively looking at how patients are reacting to it. And then from there, we're going to make, additional recommendations. And that's why I think, it's going to be inevitable that everyone's going to receive a booster over time. But once again, we have to continue to follow the science, see what's going out within the communities, looking at the lab values, and then from there, making appropriate recommendations on who should be getting it when, just to make sure that we continue to support and protect the community.
Dr. Stefas, what does this look like in your world when something like this happens?
So, obviously, we're looking at all the science, right? We're looking at all the studies that come out. We're seeing what's happening within our hospitals and within our communities. So, we're constantly looking at all the vulnerabilities and what's occurring and starting to prepare for it. So what happens is the FDA authorized its use. From there, it went to ACIP, which is the advisory committee to the CDC. They voted on it, and they were unanimous that they should need to move forward with giving this third dose to immunocompromised patients. From there, the CDC approves it, and then New York State then provides additional context surrounding who should be receiving this vaccine. From there, we just make sure that we talk to all of our providers. So obviously, in this particular place where you're focused on oncology, transplants, HIV, and providers that are taking care of patients with autoimmune diseases like rheumatology and Crohn's, we can talk to those providers. What are your thoughts? Where should the patients be receiving this? Would you like to keep this within your practices? Should we be sending them to the mass vaccination sites? All of those different pieces go into place. And then we put together communications and we push it out into the community. And we make sure that we have vaccine easily available, accessible, and equitable out there to make sure that anybody that needs a vaccine has that ability to receive it.
So you just mentioned equity. What does that mean?
So equity means that the vaccine is accessible to everyone that needs it, and it goes to the most vulnerable populations that could have the worst outcomes kind of associated with the coronavirus. So we have a health equity task force today, and we're constantly taking a look at the data on, what zip codes are vaccinated, what percentages, what does that mean, And then we're making sure that we're going into those communities and offering the vaccine, as well as educating patients around the vaccine, because those are two very important things that we need to do. And a lot of times what we'll do is we'll work with local leaders within those areas.